Hi, everyone. Let me turn my sound up here. Hi, everyone. Today is Thursday, July 2nd. I'm April Roll, your ER doctor online, and today I'm doing a video about shortness of breath. Um, Basically answering some general questions about shortness of breath and also what you should do if you have shortness of breath, and also talking about is it COVID or is it not COVID? So I'm going to jump right in. If you have any questions, just put them in the comment section and I will address them as I see them. So, shortness of breath, what does it actually mean? If you're feeling like you're having difficulty breathing or you're not getting enough oxygen, or you actually feel like you're having to work to breathe, bring in oxygen into your lungs. That is what we're talking about when we ask, are you feeling short of breath? Um, for example, if you're just sitting in a chair, or if you're doing something like walking to the refrigerator, walking to the restroom, normally you don't have to think about or even feel the fact that you are breathing because it's just an automatic function that your body performs. But if you are feeling like you're getting out of breath just sitting down or just walking to the kitchen, walking to the bathroom, or you're physically having to struggle to pull air into your lungs, that's what we mean when we say, are you having shortness of breath? So there are some conditions that generally people have shortness of breath, either periodically, whether it be, a seasonal thing, a monthly thing, weekly getting short of breath, or even daily getting short of breath. I'm going to go over some of those conditions. So the most widely known condition that people have shortness of breath with is asthma. So when people are having shortness of breath from asthma, it's because they're having spasms in their airway and inflammation in their airway, where when normally you breathe in air, you exhale air freely. Think of their airways as a straw. If anybody knows what boba tea is, you know that the boba tea comes with a huge straw, and the purpose of that is because the boba balls are huge. You can't really drink boba tea with a regular straw. So think of boba tea straw as a normal airway, right? So air is a lot of air can get through this large hole. But if you think of an average size straw compared to the boba tea straw, um, much less air is getting through this hole. So that's how you can think of asthma. When a person is having an asthma attack, they have inflammation and spasms in their airway. So this is a spasm, right? Um, Something is contracting and you see the hole is getting even smaller. So as that's happening, less and less air is able to get through this space. Whereas someone with a normal airway, like the boba tea straw, a lot of air is getting through here, no problem. So that is uh, a time where a person with asthma would be getting short of breath because physically the air is not able to get in or out as quickly as it normally would when that person is not having an asthma attack. And that's why they have to take certain medications like albuterol inhalers in order to open their airways, in order to have more air flow freely through their airways. Another condition that is similar and in the same category, kind of like a reactive airway disease a little bit, is COPD. COPD is chronic obstructive pulmonary disease. And people who get COPD are usually people who have smoked for a long period of time or are still currently smoking. It's almost like you can think of it as chronic asthma. It's not really going away. You've already made the changes to your lungs where any little thing can get you into a COPD exacerbation, such as you catch a cold, you have seasonal allergies, any kind of dust particles get in there. Their lungs are way more reactive. Therefore, they're going to be more likely to go into spasm and get inflamed. And like I mentioned before, with the straw analogy, again, they have a tiny, I'm trying to go to the camera, they have a tiny hole and also spasm. This is their airway basically when they're having COPD exacerbation. They have inflammation in their airways and they're having spasm to the point that no air is able to get through here. And that's a chronic condition that they have to deal with. So they get short of breath again because physically it is more difficult for oxygen to get into their lungs as well as get out of their lungs because they're air trapping, and it's hard also for them to exhale, almost as hard as it is for them to pull air into their lungs. And again, that's what I'm trying to explain to you in terms of shortness of breath. They are physically having to pull air into their lungs with their respiratory and thoracic and chest muscles in order to get air into their lungs, and that's why they're feeling short of breath. Another condition that can cause people to have shortness of breath is called CHF or congestive heart failure. And in that condition, you have a buildup of fluid into the lungs. You can kind of think of CHF when a person with congestive heart failure gets into a CHF exacerbation. You can think of it as one of those just regular cleaning sponges, the foamy ones that have the little holes like Swiss cheese in it. You can think of someone who a regular lung is a dry sponge, right? It has a bunch of holes like Swiss cheese, and again, air is freely moving through those holes. No problem at all. But what happens when you put the sponge into water? The holes of the sponge and the even the tiniest holes that you can't see in the sponge, the water is sucked up into that space. So if you take that sponge out of water, air is not going to be able to freely move through that sponge. And that's what's happening when a person is having congestive heart failure. Their lungs are filled with fluid. And again, they're short of breath because they're physically trying to pull air into the tiny little spaces where fluid is not occupying. So it's kind of a surface area thing. They have less lung to participate in gas oxygen exchange, so they're feeling short of breath because they physically don't have a lot of space in their lungs that's, taking in air, taking in oxygen, able to participate in gas exchange until they're able to get that fluid off, which again, with an analogy, would be kind of like squeezing the sponge out, squeezing that fluid out of the sponge. Um, so that's why they're feeling short of breath. Another condition where someone may feel shortness of breath periodically or chronically is people with lung cancer or even just fibrosis of the lungs. Any kind of condition where the actual surface area of your lung is being taken up by either uh, fibrosis, nodules, masses. Those are areas in the lung that are no longer able to participate in gas exchange or oxygen exchange, and the person feels short of breath. So, those are just some conditions I wanted to go over in order to help people understand, like physically, people with these conditions. Even I'm going to throw in there sarcoidosis, honeycomb lung, cystic fibrosis, may be some other conditions that you all have heard of. And these are all conditions where people may feel short of breath. So this topic of today though is COVID or not. So I've just given you what we're talking about when we ask you what is shortness breath. Are you feeling short of breath? I've given you kind of what you should be paying attention to if you feel that, and what is called shortness of breath. I've given you some conditions where people may always feel short of breath. And now I'm going to talk about, is it COVID? Because that's what everybody wants to know, or is it not COVID? So I'm going to let you in on a little secret. We don't know if it's COVID or not, right? Because COVID 19, the symptoms of COVID 19 range anywhere from zero symptoms, asymptomatic. You feel fine. You're out here walking, you playing basketball, you swimming, you're doing whatever you do, and you feel fine. COVID 19 ranges from zero symptoms to cough to shortness of breath. So, if you are having shortness of breath, my recommendation would be to just assume you may actually have COVID and get yourself tested. Isolate, quarantine, wear a mask, protect yourself. Now, if you are somebody who has one of the conditions that I previously named, asthma, COPD, CHF, lung cancer, sarcoid, cystic fibrosis, honeycomb lung, any kind of lung chronic condition, you really need to be diligent about who you are letting yourself be around. Because I've seen a lot of patients in the hospital where they're like, well, but I've been isolating. I haven't been out of my house since March. You know what I'm saying? And, but my follow up question is, but who's been to your house? Like, you have family, or even if you don't have family, do you have friends? Do you have neighbors? Are people, if you're someone who, depends on caregivers to help either bring you groceries or, come in, clean up around the house, or, make sure that you have dinner cooked or anything like that. Anybody coming physically into your home, you don't know what they're doing. You don't know where they're going. Like, they may not be taking the precautions necessary, or even like wearing a mask. There are a lot of people who are just so against, like, they feel some type of way. I feel like they feel offended that they have to wear a mask. Like, people get so mad about this whole mask situation, when in reality, all we're trying to recommend and advise is that you are protecting yourself and others. Okay? If you're talking to somebody who's wearing a mask, especially because that person has CHF or lung cancer or COPD or asthma, if they are wearing a mask because they're following the rules, but you're talking to them, you're not wearing a mask, guess what? All of your the aerosols and the little droplets that are coming out of your lungs are going onto them, okay? The eye is a mucous membrane. You're basically, if I mean, for lack of a better term, to drive the point home, you're basically spitting in their eye, and you potentially have corona, okay? You're potentially spitting coronavirus into their eye. And that's the part that people don't understand about the whole mask thing. If the person is wearing a mask and you're not wearing a mask, that person wearing a mask is not 100% protected, because your droplets are going onto them, especially if you're not 6 feet or greater away from them. So I just want to, talk about those kind of things. Please protect yourself. Please protect other people. And please understand that if you have shortness of breath, it may be COVID 19. So you should get tested. You should take precautions. I've even had people that, were doing callbacks at the hospital for people who had no symptoms but were exposed to coronavirus, um, who have come back positive, and they're in complete shock, which makes me become in complete shock, because I don't understand how people don't understand, if you're near somebody, like literally, you're here with somebody with coronavirus. You know they have coronavirus. So then you want to go get tested. But when I tell you that you have coronavirus and now you have to quarantine, it's such a, oh my gosh, how did I get coronavirus? And I'm like, you just told me you were exposed to somebody with coronavirus. That's how you got coronavirus. So it's just very interesting. So I just wanted to come on here today, discuss what shortness of breath means, who may have shortness of breath chronically, and is it COVID or not? I don't know if it's COVID or not. It very well may be COVID-19, so you should get yourself tested. In the meantime, in the process of waiting for the test, you need to isolate. People around here getting tested, and then they're still freely going to the grocery store, going to the mall, going to their friend's house, having parties at their house, or going to other people's house to have parties. If you've been tested for COVID-19 and you don't know your results yet, you need to be isolating and quarantining and wearing a mask because you don't know yet whether or not you have it. So you need to take the proper precautions to protect yourself, protect your family, protect your friends, and not go spreading around to all, random people. Even if you don't have shortness of breath, you don't have any symptoms whatsoever, you could have COVID-19. So I just wanted to put this video out there. Thank you, Dr. Sharp, for joining the conversation. Thank you, Donna Bellamy, for joining the conversation. I don't see any questions here in the comments, so I'm going to end it there. And just in general, leave the message being that take precautions. Even if you don't have shortness of breath, you may have COVID-19. Get tested, protect yourself, and protect your loved ones. Okay? Thank you for joining me again. Be blessed and stay healthy on this Thursday, July 2nd. Have a wonderful day. Bye.